Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Coming to the pathology of migraine, there is abnormal increase in the size of the cerebral arteries or cerebral veins. So what happens here is due to some chemical imbalances. At first, these cerebral veins or cerebral arteries will contract. Over a period of time, they will expand and they will produce headaches. And coming to the conventional treatment in the sense, if you are diagnosed with migraine, you will go to a doctor nearby your home, or you go to a corporate hospital, or you go to a neurologist. The treatment given by these people is considered as a conventional treatment. There are a lot of disadvantages in this. They don't have any medicines to completely remove the tendency of the migraine, but they will just give the symptomatic treatment. By the time you take the medicines, it will be reduced. After that, it will start again. For example, if you have severe pain, they will give you the painkillers. Painkillers has lot of side effects. And if you have nausea or vomiting, they give antiemetics just to suppress the nausea or vomiting. They cannot completely remove that tendency. Disease is a concomitant of other disease. For example, if you are depressed, so they will give antidepressants. If you are anxious, they will give tranquilizers and also antihypertensives. See, all these antidepressives, any psychiatric medicine within allopathy has lot of side effects. Better not to use them. So, because you have very good opportunity for clearing this completely or curing this completely from the roots without side effects in homeopathy. Coming to homeopathic treatment, there is a lot of success rate for homeopathic treatment in case of migraine. Migraine is one of the diseases where it can be easily cured with homeopathy. How we can cure with homeopathy is very interesting. We use a treatment called constitutional treatment. Constitutional treatment is a treatment in homeopathy where we consider your physical changes, physiological changes, and psychological changes. Coming to physical changes, so there will be enlargement of arteries or veins in your brain. That is considered a physical change. And what are the physiological changes? Physiological changes are there will be altered hormones in your body. There will be digestive problems or metabolism problems. These are all considered as physiological changes. And coming to psychological changes, in case of migraines, you may have anxiety, you may have depression, or any other psychological condition. What we do is we take all these symptoms and we give a medicine which is going to tackle all these symptoms at these three different planes, so that your disease is completely cured. Normally, in most of the people, it is completely cured, and in most of the cases it is prevented. It will not come again and again. In very few cases where there is cure is not possible, we can reduce the intensity of the symptoms and reduce the frequency of the symptoms. But in most of the cases, we can completely cure it. Once we cure it, we can prevent it from further occurrence. So this is about the constitutional treatment. Apart from the constitutional treatment, or along with the constitutional treatment, we will also give drugs based on the individual symptoms. For example, your headache is due to irritability, so we have separate medicines. If it is for depression, we have medicines. If you are in bipolar mood disorder, so we have separate medicines for it, based on your cravings, based on your muscle stiffness. If you have constipation or diarrhea or sensitivity to light, smell, or noise, based on this, the drugs may be different. And also, when there is flickering in front of the eyes, is it zigzag lines, or the lines are black and white, or the lines are colored? Any part of the visual field is lost, or central part is lost? Do you have any visual delusions, thinking that uh, actually the thing is not in front of your eyes, but you think that it is present? So for each of these conditions, we have separate medicines. And also, auditory hallucinations, if you are hearing something that is not in the surrounding, we have separate medicines for it. If your skin becomes sensitive, it becomes tingling, or it becomes sensitive when the cloth is touched to the skin, you feel more pain, we have separate medicines for it. And also, in the pain phase, if it is associated with vomiting, or if it is associated with sensitivity to light, sensitivity to smell, so we have different medicines. And also, based on the type of headache, is the headache throbbing headache, or is it a pulsating headache? So depending on this, we also give additional medicines. And also, based on the location, where is the headache located? Is it on left side? Is it on right side? Is it on face? Is it settling on some of the eyes, or is it in the nape of the neck? Sometimes the pain radiates to neck. Based on the type of pain and the character of the pain, you may receive additional medicines as well. And also depending on the prodrome in this, if once the pain is relieved, how are you feeling? Are you feeling depressed? Are you feeling exhausted? So based on this, we will give different medicines. Basically, this is the combination of constitutional treatment and also your individual symptoms, so that your disease can be tackled from all the directions, and you have best cure with us with Fidicus Homeopathy.